Hello, Professor. My name is Himani, and this is my capstone presentation. Over the last 2 years, we have seen how COVID has affected us both physically and mentally. Although the physical effects of COVID are taken into account, the mental health problems are usually remaining unrecognized. Therefore, I chose this topic to address the mental health problems faced by the nurses during the COVID 19 pandemic over the last 2 years. So the nurses faced a lot of problems such as depression, anxiety, fear, frustration, distress, etc. And this happened because they were not prepared for the pandemic and its consequences. A lot of nurses who were taking care of the COVID patients got the virus and they turned positive, which led them to remain in isolation. And this increased their fear or anxiety because they had to cut the contacts, the physical uh, contact with their family members. This became an issue when the positive staff could not work and it increased the workload on the working staff. In addition, a lot of nurses left the jobs and the profession, which increased the already existing shortage of the nurses in the country. Moreover, there was an insufficient supply of PPE kits in the hospitals, which raised the issue of work safety in the hospital. Therefore, a work plan was proposed in which an implementation plan was given, which can be through there should be an initial and active physical and mental health assessment, and this can be done through the professional help of psychiatrists. This should be organized by the hospitals for the nursing staffs. Also, the hospital should ensure that there is safe use and disposal of the PPE kits in the hospital. In addition, the nursing leader should ensure that a roster or a rotation plan is made in a way that one nursing personnel must not be exposed to the virus for more than a month, and this reduces the duration of exposure and gives some relaxation to the nursing staff. Also, the hospital and the leaders should always motivate the staff, and this can be done through a word of encouragement or monetary benefits. So, after this work plan is proposed, we can expect some outcomes which are positive. Firstly, the mental health consultations can help to reduce or prevent the further depression or anxiety in the nursing staff. In addition, since the PPE kits are supplied effectively and the use is done efficiently, we can expect that the workplace environment is safe for the nurses. But we have some barriers in implementing this plan, which is that the fear of transmitting the virus to the family members of the nurses always remains because the nurses might have kids or the elderly at home. In addition, the nurses might lack the interest in the counseling sessions, even though they are provided by the hospitals or the administration, or they might not have time for an additional work to do. To sustain this plan, we have a sustainability plan, and this can be taken place with the help of vaccination, because a lot of researches have taken place and the researchers have seen that when the nurses are chosen for the vaccination, the first or the second dose, they feel protected by the vaccination, and this reduces the chances of depression and anxiety in nurses. Also, since the PPE kits are being supplied effectively, and we expect that they will be supplied effectively and in sufficient amounts, the fear of transmission is reduced. But the sustainability plan for over 5 years has some barriers of its own, which is that the nurses might not want the vaccination, because a lot of nurses who have taken the vaccinations have experienced some side effects and some symptoms, which prevents them to take the further doses. So there's always this anti-vaccination probe going on. Also, uh, we have to ensure that the nursing units have been staffed properly, like they should be overstaffed, and this can be done through travel nursing and agency staffing to ensure that the sustainability plan is in place. Also, as a nurse leader, the leader should ensure that the nurses are taken taken care of physically and mentally, and there should be education about the vaccination, and there should be an encouragement to get the vaccination as much as possible, and the nursing leader should prevent the understaffing. So this is how the sustainability can be made for this plan, and the COVID-19 and the mental health of the nurses can be preserved. Thank you so much.